Flu season usually peaks between January and March, but that doesn't mean you can let your guard down just yet. The Harvard Medical School shares several misconceptions about the flu to keep in mind. You cannot catch the flu from a flu shot. The virus used in the vaccine is technically dead and cannot cause infection. It can take a week or two for the vaccine to take effect. If you catch the flu within that time, it's a coincidence. Even if you're a healthy person, a vaccination is recommended. A strong immune system may prevent you from having any symptoms, but you could still spread the virus if you have it. Even if you got a flu shot last year, doesn't mean you should not get another one. The virus mutates over time, making that old vaccination obsolete. Flu season isn't caused by winter weather. It coincides with it. That's why when spring rolls around, it doesn't necessarily go away. And lastly, antibiotics won't help conquer a virus. If your symptoms persist for more than a couple of days, consider seeing a doctor for an effective solution. Ed Neuzil, Board Certified Nurse Practitioner at the Allergy, Sinus, and Asthma Family Health Center, explains the importance of a flu shot.
The flu season is generally looked at from the first of the year, January 1st through March 30th. Now, it doesn't mean you can't get the flu other times of the year. You can get a flu in November, December, just generally not as common. If somebody does get the flu in more elderly patients because of the loss of sodium, potassium, other electrolytes from the vomiting, from the diarrhea, it can be quite fragile, and this is where we can look at something being quite deadly, because it does not take a week for somebody to become dehydrated. Actually, in some individuals, a couple of days is enough to cause them severe consequences. So they lose a lot of fluids, they lose the potassium, they lose all these electrolytes that are necessary for the body to function. So for anyone that has severe symptoms and it lasts more than 24, even up to 48 hours, they start to have to look at the fact that I may need to go somewhere and get something done. Those individuals that can recognize the fact that they're getting the flu early and within the first 24, 48 hours of the symptoms, there are medications such as the Tamiflu and other ones that can be given, but after you reach that 48, 72 hour type of condition, their benefits diminish significantly. Everyone that does not have a contraindication to get the flu shot should get it. The fact that you were lucky and never got sick doesn't mean that tomorrow's not another day. It's your immune system, it's your exposures, and it's blessed that you didn't get the flu in the past, but you can still get the flu, and the flu can just be as deadly, even though you've never had the problem before. Side effects to the flu vaccine are minimal. Generally, if you get anything, it's more of a reaction due to just the injection. And if people get that, they can take some type of acetaminophen to help with that, and it usually lasts just 1 or 2 days. The flu is something more severe and something that can be potentially deadly. So I tell patients, let's see, what do we have? Maybe a little sore arm versus now I'm dead. The flu shot is something, or influenza vaccine is something that people really need to look at, and as suggested, something they need to receive, if not contraindicated, every year.
How to know whether it's a cold, flu, or allergies was just one of the many questions Ed Neuzil fielded during a recent seminar. Ed was a guest speaker at the Health Basket in Mount Dora a few weeks ago, sharing his knowledge of allergies, what triggers them, and how patients are tested for them at the Allergy, Sinus, and Asthma Family Health Center. Now in its 6th year of distribution, Ed Neuzil shared some background and benefits of his Dr. Neuzil's Irrigator Herbal Enhanced Nasal Spray. Ed explained how he developed the convenient pump spray for his own patients and family as an alternative to medicated or messy options. Irrigator nasal spray is available throughout the U.S. and Puerto Rico, including the Health Basket and other local stores. For a complete listing of retailers or online options, you can visit irrigatornasalspray.com. To get in touch with Ed Neuzil and the staff at Allergy, Sinus, and Asthma Family Health Center, please visit our specialist directory. Just click the Extended Flu Season tab on our homepage, yourhometownhealth.com.